Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hello, and welcome back to another episode of What Did the Patient Say with our patient interview series. My name is Dr. Peterson, and today we'll be talking with my patient, Kathryn, about her experience going through treatment at CFNC for dizziness and headaches. Thank you for joining us today, Kathryn.
Thank you for having me.
Of course, it is our pleasure. So to start off, can you tell us what were some of the symptoms that you were experiencing initially, and when did these symptoms start?
Okay. Initially, it started in like May 2023, just having some really bad headaches. And I was never a person that had headaches before then. And so it just was kind of lingering, for a couple weeks. And one day in particular, it was really bad, just like the whole head. So I went to an urgent care, and they're like, well, your blood pressure's high, that kind of stuff. And so not a whole lot came from that. And so then like a few weeks later, I was running, and then that's when the dizziness started. And I was like, okay, what's going on here? Because felt like, I was like this when I was running. And I also was having pain in the back of my neck, like in the occipital region. And then from there, like the brain fog, like everything just sort of escalated from that point on.
Mm-hmm. And I think it's also important to note that a few years prior to the start of some of these newer symptoms, we also had a bout of vestibular neuritis. Is that correct?
2020. In 2020, I had the flu and then strep throat back to back, and I ended up losing some balance in the right ear. And so, yes, definitely had that in the background.
Yeah, for those who don't know, vestibular neuritis is essentially a condition where we have some sort of infection that then infiltrates the nerves that are associated with the vestibular system. That can cause inflammation and irritation, and over time, if it causes damage, it can cause loss of function, like Kathryn here experienced.
Mm-hmm.
And given that history, and then what she was experiencing with some of the dizziness and the symptoms that came later on, it's probably safe to say that it was a sequela or an after effect of some of the damage that she sustained earlier on. So thank you for sharing that, Kathryn.
Mm-hmm.
The next thing I want to ask, and you kind of touched on it a little bit, but what type of care did you receive prior to coming to CFNC?
Well, the vestibular neuritis in 2020 was diagnosed by the ear, nose, and throat doctor. And then that was kind of it for that after he kind of said what it was. And then when the headaches started back, I ended up at my family doctor, and they all said, you're having migraines. And they were giving me migraine medicine. And I was like, but this is like, it keeps happening. Typically, if you take migraine medicine, it at least calms it down for a few days, but it wasn't. So then they were like, okay, we think you should go to a neurologist. And so I went to a neurologist, and she was like, I think it's migraines, but I want you to go see your eye doctor. I had brain MRIs. I had CT scans, I guess, to look at the blood flow. And went back to the ENT, and everyone said it was migraines. And I just knew, I'm like, this is not migraines. And this whole time I was consulting with my chiropractor, who we've seen forever. And, he was like, yeah, I don't know. This doesn't seem like migraines. And so I just kept getting pushed around from place to place to place. And I stopped I didn't keep up with the migraine medicine because I just didn't think it was working.
Mm-hmm. And then you eventually found us.
Yes.
So tell me how that happened.
That is being your own best advocate. I knew there was a better way. So I honestly, I Googled vestibular rehab and you guys came up. And I was like, "Oh my gosh, it's Huntersville. That's not far from me." And I was thinking, "Okay." And I mentioned it to my chiropractor. He's like, "Yeah." He said, I've heard about them. That's probably a good thing to do." So thank goodness you all have an amazing website and social media. I just felt like anything like I watched videos, I read all kinds of stuff. I was like, this is it. This is my people. This is what's going on. I knew for sure that you guys would not know what was going on.
That's great. Kathryn originally came in for the initial exam, and after that whole process, identifying that she indeed was experiencing some central vestibular dysfunction, we shortly after hit the ground running with treatment. So for that initial phase of treatment, we had her coming in 1 day a week in kind of an intensive format where we would see her multiple times in that single day. And throughout those visits, we were doing a combination of things like cranial nerve stimulation, other forms of vestibular rehab with eye movement therapies and gaze stability exercises, and then also doing things like complex movements to try and help stabilize all of the systems and other areas of the nervous system, essentially, that help when it comes to modulating the vestibular system, as well as contributing to overall balance. We also did some red light therapy with her and beamer pulse electromagnetic field therapy all throughout that span. And then after those 4 weeks, we did a re-exam with Kathryn, and she had made some pretty significant improvements in a relatively short period of time.
Absolutely.
And so at that point, we decided, well, let's just go ahead and move to monthly check-ins. And so we continued, sent her home with exercises to basically take what we were doing in the office and do them in a way that she could continue at home. And then every month for, I believe it was, well, 6 months, essentially, or every month. And then we went to 3 months.
Mm-hmm.
And just doing regular check-ins, making sure that everything was still looking the way we wanted it to. And up until last week, we were keeping up with that frequency until we decided, you know what, Kathryn, we have been so stable for so long at this point that I think it's ready to let you out of the nest and be free on your own again.
Mm-hmm. Yeah, even though I may not have wanted to because I feel so comfortable there. But yes, it was time. And I feel good enough too. So
Absolutely. Absolutely. And again, we are always here should anything happen, but we're at the point now where I think you're ready to handle it on your own. As far as your experience, how would you describe your experience as a patient at CFNC?
When I first came, I was so nervous because all the other doctors prior to, I just felt like no one was taking me seriously. And they were like, it's this, just keep taking this, or take that, change to this medicine. And I just really felt like, okay, is anybody really gonna listen to me? And I remember the first one and doing the test, and I just cried because because Dr. Brindisi looked at me, she's like, yeah, this isn't migraines, and I think we can help you. And I was like, okay, yes, so just since then, of course, everyone is so nice and sweet and lovely. And then all of my other treatments have been with you, Dr. Peterson, and it's just been, I just feel so comfortable there that I can talk to you all about anything. And, even like if I've had like a little, like, I'm feeling a little off, like, during some times where I wasn't coming, I just emailed you and you're like, okay, what's going on? Or, if it gets worse, you may need to come back sooner. I cannot praise CFNC enough for just how comfortable and actually fixing and addressing the problem. It's been wonderful.
Oh, that's great to hear. So, compared to when you first came to see us, I think it's fair to say that you're feeling pretty good today.
Yes. Yes, for sure.
That's great. If you had to give a percentage to your overall improvement from when you first came in to see us to where we're at now, what would you say?
I was thinking about that today. I'm one who tries to be a little more conservative, but I really think I'm like 90 to 95% better. And only the little bit just because, I'm still working through some things just because of the vestibular neuritis I had, But as far as headaches and brain fog, especially, all of that is just so much better. I definitely say 90, 95% better.
I love to hear that. And now I have one more question for you.
Okay.
And that question is, if you could give any piece of advice to somebody who may be a potential or future patient at CFNC, what would that advice be?
To trust your gut and just, when something's not right, and that I would just at least explore what you guys have to offer there. I mean, it's just, I just think that we all know inside when your needs are not being met, and that you really just have to be your own advocate and just go. You just have to. I've talked to other people about your practice, and I'm like, just go for an initial meeting. It's totally worth it. And I even told you the day I left, I was like, it was life-changing. It literally was. Like, I feel back to myself, my independent self again.
That's amazing. I think that's great advice. And something you said earlier too is the idea of, being your own advocate. I think that's important too, and being willing to, look, what are the other options if your needs aren't being met?
Yes, absolutely.
All right. Well, wonderful, Kathryn. Thank you so much for taking the time to join us today and share your story with the world. For everyone listening, if you have any questions, please leave a comment or feel free to reach out to us. Also, please visit our website at carolinafnc.com for additional information on our treatment programs. Thank you and have a nice day.